Hi, I'm Dr. David Hill, and today we're going to be talking about hives and how to treat them when they happen in babies. Now, when we say hives, we're not talking about places that bees might live. That's a different kind of hive, and if you find that in your baby, you should be really distressed because that just doesn't make sense. But a hive is really a kind of a rash, and we think of it as sort of a large raised bump, and by large I mean, maybe a ½ inch to an inch in size. Usually the bumps are sort of pale with some redness around them. We call that a wheel and flare reaction, and they're a type of an allergic reaction. Now, a lot of things can cause hives. Many of the common causes are medications. However, you can also see hives with foods. You can see hives when children get a viral illness, when they get too hot, too cold, emotional. There are quite a few causes. Sometimes you can identify the cause. Sometimes you really have no idea. When they come back again and again or fail to go away, sometimes you'll ask an allergist to help by perhaps doing some allergy testing. The easiest thing to treat hives with are antihistamines, and in babies older than 6 months, we can use second-generation antihistamines like Zyrtec, which is cetirizine, or Claritin, loratadine. Those work very well. They last 24 hours, and they're both effective against hives. Note, Claritin itself is not approved in babies between 6 months and 2 years of age, although some people do use it off-label. There's a branded, slightly different version called Clarinex, desloratadine, that is approved down to 6 months of age. However, if the Zyrtec, cetirizine is working for you, that ought to be fine. Now, you can also alternately use a shorter-acting antihistamine like Benadryl as well. And when they get bad, some doctors will even prescribe what we think of as an antacid, an acid reducer like ranitidine, Zantac. However, medicines like ranitidine and Zantac actually work on the same histamine system that other antihistamines work on. They work a little differently, but you can combine those for greater effect. Some people will try and treat hives with steroids. It's something that we do commonly. It's very difficult to find a study that shows it actually works or helps, but it is a widely accepted therapy for more severe allergic reactions, and don't be surprised if you bring your baby in for hives and you walk out with some sort of steroid therapy. You might also try sort of a cool bath or cool washcloth to help with the itching. However, the good news is most of the time hives get better. Now, sometimes hives are associated with more severe allergic reactions. So if you notice swelling of the lips or the mouth or the eyes, if you notice the child is having a difficult time breathing or wheezing or coughing excessively, that's an emergency, and you really want to get that child seen immediately, possibly emergently. So, talking about how to treat hives in babies, I'm Dr. David Hill.